When you take contraceptive drugs, you have severe headache.
Yes, welcome to Noble TV Live. Today with Augustine Omilo, I'm discussing an important issue, particularly amongst women. That is the dangers inherent in contraceptives and abortion amongst women, particularly the young ones at that. And I don't have enough knowledge in this area, but I have somebody who will do justice to this issue, and you may be the one that is going to benefit from it. But if not you, somebody else. And of course, at the end of the program, when you have had all that we are going to discuss, and if it makes sense to you, you should do well to actually share with others, because we are in an era of knowledge. With me to discuss the matter is Sim Derengwankwo, a renowned nurse, and of course, you will be glad that you are with us today. So you are welcome to the program.
Thank you, sir.
Yes, I'm comfortable defining what abortion means, but when you say contraceptives, what do you actually mean by that? Because some of us don't understand.
Okay, contraceptive drugs
are
the drugs you use in preventing pregnancy.
Okay.
The drugs that they call contraceptive drugs. So, as an individual, or as someone that is learned, or someone that is in the field, you will say that contraceptive drugs are those drugs that when a man and a woman have sex, the drug the woman take to terminate the sperm from producing a baby or forming a baby. Okay. So they are what is called contraceptive drugs.
Okay. Then the abortion is the next to it. Abortion is when, right?
Yes, abortion is when you don't take the contraceptive drugs. That means the baby can be formed because you actually had sex.
Okay.
Yes.
Okay, then when you now abort, you are aborting a really formed baby.
Yes.
Okay.
Whether 1 week, 2 weeks, 1 month.
Okay. Now, the next question is: are there types of these
contraceptive drugs? Yeah, there are.
Yes, and the two questions now: are there types of these contraceptive drugs? And what are the ways also of performing abortions in such ways that it will not be injurious to the persons that are actually involved?
Okay. I would say that there are many types of contraceptive drugs, which is they have post-natal, they have post-pill, and many other ones. Because it's company that differs, but they do the same work. Okay. But because of company, there are so many companies that produce drugs, so that is just different. But there is nothing much. It's just that it's the same drug, but just the company. Okay. So when you talk about what are the dangers, or what the way that if you get pregnant, like abortion, you want to do abortion, what are the things that you do that will not be harmful? Honestly speaking, there is no way you can do abortion that it will be that safe. There's no way that when you abort a child, or when you take or do CS, anything that you do, there's a side effect of anything called abortion. Okay. So that is just it.
Now, you have mentioned some types. What are the implications as it is, or the side effects of using contraceptives? Particularly people, you may be having, you have had children, maybe 1, 2, 3, and now you say you don't want to have more, and you begin to get yourself involved in this consumption of contraceptives. And what are the types of, you mentioned that you were using some legal terms. I want you to reduce it to like maybe drugs. Maybe there are some contraceptives, ways of preventing pregnancy that either you fix in a private part, or the one that you take as drug, either by taking it orally and all that. I want to.
Okay. Yes. Thank you.
Okay.
When it comes to the ways you can take contraceptive drugs, or you can prevent it, there are so many ways you can prevent it if instead of taking the contraceptive drugs. Yes. That is natural remedy, natural ways. Okay. Which is using protection. You can use protection instead of taking the contraceptive drugs.
Okay.
Yes. Okay. So that is just it.
Okay. What is the rate of safety, in terms of, because I want to believe that when you say preventions or precautions and all that, you are talking about maybe somebody using condom, for example.
Yes.
So what is the percentage assurance of the result actually you expect from this compared to the result you get from when you take maybe like drug or other methods?
There's no how you will use protection, which is condom, that you can get pregnant, unless if the condom is being tempted, like there is a crack or someone opened it. But once it's safe, once there's no harm in it, you are good to go. There is no need of a contraceptive drug. Okay, let's look it into this way. When you take contraceptive drugs, you have severe headache. It comes with headache.
Side effect.
Yes, the side effect of it. It comes with headache. It comes with, it can cause breast cancer. Yes. It can cause abdominal pains. It can cause blood clots. So that is just the reason why I don't advise anybody to be taking contraceptive drugs. That is it.
So the better ways of preventing pregnancy remains maybe like abstinence.
Or when the man is about to release it, can pull it out. It's just better. Or if you can dictate your cycle well when you're safe and when you're not safe. Because there's no way when you're not safe. If you're not safe, that is really when you can be pregnant. But if you're safe and you know you monitor your cycle well, you read it well, you get so used to it, yes, you are good to go. You can avoid unwanted pregnancy.
So finally, now somebody, maybe a married woman, a young lady who is not married, want to now get involved in this consumption of contraceptives. Is there any advice you can give to such people in order to avoid the dangers inherent in them?
Okay. The advice I will give to anybody, both married or unmarried, that is having carnal knowledge, unprotected sex, is that contraceptive drugs are very harmful to the health. Very, very harmful. Because it makes you, the first is changing your menstrual cycle. It changes it. Second is risk of breast cancer. Third is you having abdominal pain, constant headache, and it can lead to weakness of the womb. It can make you to gain weight. It can affect you mentally. That is just it.
Now, anyway, you are watching this program, you have had it all from Chief Sundere. Yes, we have just talked about the dangers that are inherent in the consumption of contraceptives, and of course, the elder sister, which is abortion. And you have had all that she said. Yes, you can be involved to be consuming contraceptives, but the danger in it is that one, with time, you may be having cancer, breast cancer for that matter. You can add weight even when you don't need it. Two, you may be having abdominal pains. And three, it can lead to, she said abnormal behavior. But let me tell you, that is insanity. It can lead to insanity. Somehow maybe mind insanity and all that. And above all, it can also lead to the weakening of the womb. So maybe you want to have babies later, you may not be able to find one. And therefore, according to what she suggested now, that you may get involved better with protective measures, which means like using a condom and all that, but you must be very careful. But otherwise, also, you can get yourself involved in sex, but ensure that you don't, let me use the language that the ordinary person like me use, you don't release inside the private part of the woman. You ensure that you withdraw at the point of release so that your sperm will not form anything inside the woman's body. So on this note, I want to draw the curtain on this program today, and believing that when you watch, you not just watch, you'll also share and comment. Just as I said that you should press the notification button so that when next you tune on, you get whatever latest we are bringing to you. Thank you very much for watching. My name remains Augustine Emilio.